The data point, 2008, clinical classification of PH. PH has been classified into 5 clinical groups according to pathology, patho-biology, genetics, epidemiology, and risk factors. 1. The prognosis and management of each type of PH depends on the cause or underlying associated condition. Table 3.1 Classification of PH 1.1 1.2 1.2.11.2.2 1.3 1.3 1.4 1.4.1 1.4.2 1.4.3 1.4.4 1.4.5 1.4.6 1.5 Pulmonary arterial hypertension, PAH, idiopathic, previously labeled primary, heritable, previously labeled familial, BMPR2 ALK-1, endoglin, with or without hereditary haemorrhagic telangiectasia, unknown drugs and toxins induced associated with APAH, connective tissue disease HIV, infection portal hypertension congenital heart disease schistosomiasis chronic haemolytic anemia persistent pulmonary hypertension of the newborn 1 pulmonary veno-occlusive disease and or pulmonary capillary haemangiomatosis 2.1 2.1 2.3 pulmonary hypertension due to left heart disease systolic dysfunction diastolic dysfunction valvular disease 3.1 3.2 3.3 3.4 3.5 3.6 3.7 pulmonary hypertension due to lung diseases and or hypoxia chronic obstructive pulmonary disease interstitial lung disease other pulmonary diseases with mixed restrictive and obstructive pattern sleep disordered breathing alveolar hypoventilation disorders chronic exposure to high altitude developmental abnormalities for chronic thromboembolic pulmonary hypertension. The data point, 2008, clinical classification of PH 5.1 5.2 5.3 5.4 PH with unclear and or multifactorial mechanisms hematological disorders, myeloproliferative disorders, splenectomy systemic disorders, sarcoidosis, pulmonary Langerhans cell histiocytosis, lymphangiomatosis, neurofibromatosis, vasculitis metabolic disorders, glycogen storage disease, Gaucher disease, thyroid disorders others, tumoral obstruction, fibrosing mediastinitis, chronic renal failure on dialysis ALK-1, activin receptor-like kinase 1 gene, APAH, associated pulmonary arterial hypertension, BMPR2, bone morphogenetic protein receptor, type 2 gene, HIV, human immunodeficiency virus, PAH, pulmonary arterial hypertension,